Hello and welcome, everyone. Thank you for joining us today. We're going to talk about some of the monitoring issues. Just recently, the FDA finalized their guidance document on risk-based monitoring. We've included that information. There is a significant amount of information in this slide deck. We're going to highlight some of those important areas as we go through those slides in particular, because we want to make sure that we are also addressing some of the issues about implementation of this guidance. So as we go through looking at the objectives, we're going to talk about the FDA's Bioresearch Monitoring Program for sponsors, CROs, and monitors. When they do their inspections, they are looking at these systems. They have 3 different sets that they have that are of particular interest to us, looking at IRBs, looking at clinical investigators, sponsor investigators, and then, of course, what we're going to focus on today, looking at the sponsors, CROs, and monitors. So we're also going to look at the components of a sponsor monitoring system beyond standard operating procedures. One of the things that we see in the new compliance program guidance manual is the FDA has given us about 19 or 20 SOPs that they anticipate that sponsors or CROs should have in place for conducting their regulated tasks. We'll look at some of those for monitoring, of course, but also what else goes into place rather than just having those SOPs. We'll look at the suggested elements for those different components, identify adequate and define adequate oversight of non-employee performers. Are you responsible for your CROs and how they conduct their work if you have delegated that to them contractually? We'll also look at other measures to ensure quality monitoring and evaluate gaps in monitoring systems.